I'm Roby M. Copon from the Philippines. I'm 52 years old. I am a native from Dasmariñas, Cavite, Philippines. Way back in February 2017, just this year, I was diagnosed with tongue cancer when I complained of some sores in my tongue, yeah, and then some kind of wound that later became bigger and bigger. And then of course I consulted a doctor. At first I undergo my first biopsy and I was diagnosed with only glossitis. And then I was prescribed with some vitamin B complex and some antibiotics to cure the wound. And then after that, sometime in the second week of March 2017, just this year also, the wound and the sores did not uh, go out or did not was not cured. And so I undergo again another biopsy. This time, a biopsy wherein a mass will be taken deep down the tongue. And then on the last week of March 2017, that was then I was diagnosed with tongue malignancy, squamous cell carcinoma, well differentiated. I cried just once. I prayed a lot. I am a Christian. And then I said to myself, you have to be brave. You have to accept for your family. And also, Dr. Mu, by that time, I lost my sister also because of cervical cancer. By that time also, by March 2017, we lost my sister who happened to be, who suffered from cervical cancer way back 2015 until 2017. And we also fought for her battle. After a series of consultations, series of blood tests, series of ultrasounds and CT scans, I was given my treatment plan that I would be undergoing a combination of chemotherapy and radiation. And then, of course, me and my family have to ask the doctor, the oncologist, that how many percent would I be cured, or how would there be recurrence after the chemotherapy and the radiation? How long would be the chemotherapy and the radiation? What would be the side effect? Because of my experience of the pain and sufferings of my sister who died of cervical cancer, I promised myself and I told my family that I would never ever undergo the chemotherapy and the radiation in the Philippines. I was told that if the chemotherapy and the radiation did not work out, my tongue will be removed. And so I feel so very, very down, depressed by that time. I feel so weak. I already felt so weak by that time. I cannot eat. I cannot eat no more. I can't eat no more. No more. Can speak the right words. Find it so hard to speak. Find it so hard to swallow. When I was on that state of my on that condition, when I'm so down and my body condition is so down also, I'm so weak. A friend of my brother, he was a patient of this hospital, of Fuda Hospital, way back in 2008 or 2009. He was diagnosed with the cancer of the lymphoma. And then Mr. Carlos Pedrosa really inspired me. He even set an appointment with me because he wanted to talk to me personally and to share with me his experiences, his treatments, and how he survived cancer because of this Fuda Cancer Hospital. And then he told me that he is now back to his life, back to his normal life, healthy, although he has to undergo follow-up checkups. I arrived Fuda Cancer Hospital by June 3, 2017, and by the time I arrived here, I was welcomed by the two very nice nurses here, Sunshine and Lisa. And I was sent here in my room. The next day, in Fuda, very fast phasing of treatment. By the next day, I undergo series of blood tests, ultrasounds, CT scans, and the next day, June 5, I undergo my first chemotherapy, local chemotherapy here in Fuda Cancer Hospital. But then, after I undergone the local chemotherapy here in Fuda Cancer Hospital, I felt less side effects, less vomiting, controlled vomiting, controlled nausea, and controlled pain. There is a decrease in the thickness. It became a little soft, and I was able to speak and swallow food. That was on my first local chemo. After the result of the MRI was good, that the tumor became small than before back in the Philippines. And so the next day after my MRI, I was scheduled for my second local chemo. Right now, I'm here in Fuda Cancer Hospital. I'm in an inpatient here in Fuda Cancer Hospital, and I undergone the brachytherapy or the radioactive iodine seeding implantation last August 14 this year. And then I feel much better. I feel much healthier. I feel as if I have no cancer. My appetite is so good. I could eat everything. I could eat anything. In my feeling, the doctors here are very good, knowledgeable. The nurses, the staff, all the medical staff are all dedicated, very passionate, and very caring about your disease. Of course, there's a language barrier, but then thank you to Miss Carol, who is our translator here, who were able to make a bridge for us to communicate. And then that was my first apprehension in going to Fuda, the language barrier. But then it wasn't a problem. The language barrier is not a problem here because they have a translator who will make a bridge for you to understand each other.